hip airplanes. This one is a great move for preventing low back pain and keeping your pelvis from getting messed up from working long hours sitting at a computer. This is it's an amazing exercise, and I'd like to thank Dr. Stuart McGill for this move. You can look him up if you want. He's a back pain specialist doctor. So this move is going to help awaken all the little muscles of your pelvis, also your ankle. It's going to create some real stability and connection in your legs, which again, when we're sitting at a computer, these are the muscles that get really atrophied and dysfunctional and then cause injury when we don't train them properly. So this movement is going to bring some awareness back to these muscles. So here's how it works. The first time you do this, you're going to want to find something stable, like a wall to do it on, to hold while you're doing the exercise. Now, basically, what you're doing, you're moving from the hips. The shoulders are following the hips, and you're going to pretend like there's a laser pointer coming out of your belly button, okay? And you're going to hold on to something the first time you do this. You can take the other hand on the hip, that's fine. Now, you're going to tilt forward at about a 30-degree angle. So I'm not like way over like this. I'm not like straight up. There's just a little bit of a tilt, just enough of a tilt that I can, be right about like that, 30 to 40 degrees. Now from here, standing here, you're going to pretend like there's a laser pointer coming out of your belly button. You're going to trace that laser pointer away from the standing leg using the hips. So my hips, my pelvis, is coming away from the standing leg and then coming back down all the way. So it's even sweeping beyond the standing leg. So if my hand is imitating this laser pointer, I'm not just coming back to the center, I'm crossing over a little bit and then coming back open and then coming down. Now I'm keeping this back leg, I'm kicking through that back heel, coming down, and then coming back up, going back and forth. Now, the shoulders are following that movement. Couple of pointers, right? So as you start, you can use the support. As you get better at it, level 2, I would say, is instead of having the hand on a support, have it on your hips, right here. Inhaling up. So inhale as you open, exhale as you close. Whoa. And if you come off balance, that's okay. Okay. Then level 3, I'm switching legs just because I've been demonstrating on one leg this whole time. Level 3 is where we have the arms all the way out, opening and then closing. So again, the arms are directly in relationship. The shoulders are moving directly in relationship with the pelvis. So the pelvis here is moving and then my shoulders are following it. One of the mistakes that you want to not make, and I'll do this from this view, is just moving the shoulders without moving the hips. See, my foot isn't really moving, but my arms are. That's not this movement. The movement is coming from the pelvis. That's the whole object of this movement, and that's what makes it hard. Also, you may notice a little bit of tension and like your opposite leg may get sore. You may feel some glute on that other leg, some ankle. That's perfectly normal and natural. You want that. That's building the stability of these joints to help you move, using these muscles that don't get used a lot anymore when we're sitting at computers. So that's the move. Yeah, if you can, so do them in succession. So if you have 3 reps or 5 reps in your program, do them back to back and practice being able to do them so that your foot never comes down until the end of your set. Again, keep the heel active, keep the glute active just a little bit, just like that. Inhaling open, do it slowly and controlled. I was doing it a little bit fast there, and then down. Inhale open, exhale close. The slower you can do this, the better. Okay, go get 'em.